We're talking about infant cup feeding. So whether you're a healthcare student brushing up on your skills or a new parent trying to figure this all out, we're going to break down exactly how and why this is done to keep babies safe, happy, and nourished. Let's just dive right in. Okay, so here's our quick roadmap for today. First, why choose cup feeding? Second, gathering your feeding equipment. Third, proper positioning and placement. Fourth, monitoring the feeding process. And finally, number 5, post-feeding and safety rules. Section 1, why choose cup feeding? So you might be wondering, who is this actually for? Well, cup feeding is an incredibly versatile and safe alternative for times when a mother is just temporarily unavailable to breastfeed. It's highly effective for term babies, preterm babies who are still, building up their strength, and babies born with a cleft lip or palate. It just makes sure they get that vital nutrition safely. Now, one of the biggest medical reasons we actually use a cup instead of a bottle is to prevent something called nipple confusion. It's a very real challenge where infants basically struggle to latch back onto the breast after getting used to the completely different mechanics of an artificial bottle nipple. Cup feeding acts as this perfect bridge, really protecting their natural latching instincts. Ultimately, our clinical goals here are twofold. We want to provide a really positive oral experience, and we want to aggressively protect future breastfeeding. But crucially, cup feeding actively reduces the need for invasive nasal or oral gastric tubes. We're empowering the baby to feed orally, and basically dodging those invasive procedures whenever we possibly can. Section 2, gathering your feeding equipment. All right, before that baby is even in your arms, organization is literally your foundation for safety. You want everything right there within arm's reach. You'll need a dedicated feeding cup or just a small medicine cup, a 2 milliliter syringe if your specific feeding plan requires it, a baby bib or some tissue, and of course, the most important part, your nutrition source, pre-warmed expressed breast milk. Safety protocols actually dictate our very first physical steps here. Absolute rule number 1, check the infant's ID band and compare it directly with the label on a container of expressed breast milk. The right milk absolutely must go to the right baby, no exceptions. Then, if the parents are around, just explain the procedure to them, do your strict hand hygiene, and finally wrap the baby up nice and comfortable with a bib. Section 3, proper positioning and placement. Okay, when it comes to positioning, you must always use an upright sitting position. You should never ever cup feed a baby who is lying flat. Holding them securely upright is totally non-negotiable. It makes sure they're comfortable and, most fundamentally, it prevents aspiration, which means keeping fluid completely out of their airway. Once they're upright, I want you to visualize this exact geometry. You place the frame of the cup at the outer corners of the baby's upper lip, and you rest it so gently on the lower lip. You've got to make sure their tongue is resting inside the rim of the cup. Only then do you tip the cup so the milk flows slowly. Remember, you aren't pouring this down their throat, you're just gently presenting it to their lips. Section 4, monitoring the feeding process. Now for the actual feeding, the key here is letting the baby set the pace. They'll use their tongue to lap up the milk, honestly almost like a tiny kitten, or they'll just sip it gently. Your job is literally just to hold the cup steady, let them do the work, and give them plenty of time to swallow between sips. Patience is absolutely everything here. But hey, what happens when things don't go perfectly? What must you do if the infant coughs or chokes during the feed? Just think about this for a second. In a clinical setting, hesitation can be super dangerous. So what's your immediate intervention? You stop immediately. Do not wait to see if they clear it themselves while that cup is still at their mouth. Pull the cup away right then and gently lean the infant forward. This is a simple, gravity-assisted tilt that allows the baby to naturally and safely clear their airway. Aside from keeping an eye out for coughing, you also need to manage their digestion in real time, so stop to burp the baby periodically. This prevents gastric distension, which is just a fancy way of saying a really painful buildup of air and gas in their tiny little stomachs. Keeping them comfortable means they can successfully finish their feed. Section 5, post-feeding and safety rules. All right, once the feed is all done, your closing steps begin. First, return the baby to a prone or side-lying position. This beautifully facilitates easy digestion and keeps them totally safe if they happen to spit up. Wash your hands again for infection control. And finally, document the feeding volume and how well the baby tolerated it on both the physical chart and the electronic patient record. Before we wrap up today, there is one absolute golden rule we have to talk about. Never attempt to cup feed an infant who is not alert or who is excessively sleepy. A sleepy baby just lacks the reflexes required to sip and swallow safely, and that drastically increases the risk of choking. Having an alert baby is a mandatory requirement for safe, proper nutrition from a cup. It's also super important to put all this into the context of wider hospital policies. Squash is a baby-friendly hospital, right? That means they follow a strict hierarchy for infant nutrition, prioritizing the natural route whenever they can. Priority 1 is exclusive breastfeeding. If that's just not possible, priority 2 is administering expressed breast milk via a cup or syringe. Only if neither of those is an option do we move to priority 3, which is formula milk. Cup feeding just fits perfectly right into this philosophy by protecting that first priority. As we conclude our explainer today, I want to leave you with a quick thought. How can mastering alternative feeding methods like this reshape the future of neonatal care? By really understanding and using techniques like cup feeding, we bridge the gap between medical necessity and natural development. We protect their future ability to breastfeed, we avoid unnecessary tubes, and ultimately we keep our most vulnerable patients safe. Thanks so much for learning with me today.